Hi, I'm Dr. Dorothea Poulos. I'm a family doctor in Elgin and a member of the Kane County Health Department Advisory Committee. This is one of an ongoing series of discussions about the COVID-19 situation. Usually I'm with Martha Martinez, and she is running a little late, so I just thought I'd start on my own so people that tuned in at 7 wouldn't worry that we weren't going to be here. And as usual at our meetings, this morning we had a meeting of the Kane County Health Department Advisory Committee. So I think I'll start first with a little recap of a few of the slides, and we're going to try to show them at the same time. This is due to the technical assistance of the very intelligent young ladies here, because I could never manage this. I can barely manage to get them on my phone. So, hola, yo soy la doctora Poulos, estoy un miembro del condado de Kane, Comité de Salud. También soy doctora de familias en Elgin por más que 30 años. Cada 2 meses estamos discutiendo con Marta Martínez sobre la situación de COVID y coronavirus. Marta ahorita está un poco tarde, pero yo quiero empezar para que la gente no esté esperando y preocupado si vamos a tener esta cita o no. So the couple things that were recapped today at the meeting. First of all, if you can get that first graph on, you can see that, as everyone knows by now, we are in the Delta wave. That really sharp peak at the top, that was the first wave that hit us here at Kane. That was actually the second wave, but the first one was mostly East Coast. And then there was the next one, and then in July we had this little lull where people started feeling good and thinking that maybe we're past it, but no, we're not, because the Delta surge started. The reassuring thing is that you see that curve is starting to make a little curve downward. So, lo que se están viendo ahorita son precisamente como la primera colina muy alta es el episodio de COVID que nos ataque el invierno pasado, antes de que teníamos la vacuna, y que fue muy recio. La segunda como en la primavera, y el tercero es la última, el episodio de Delta, que todavía estamos en esta onda. La onda parece que está empezando a bajar poco a poco. Pero como vamos a discutir, eso no es razón de no tener precauciones. So the second slide explains why we're all wearing masks. There's 2 ways of look at high transmission situation. One is the case positivity. We're actually good. There's not that many tests positivity rate, but the actual number of cases is still quite high. So that is why, one of the many reasons we're masking indoors, whether you are vaccinated or not. In fact, that is why, even though I'm vaccinated, the people I'm working with today are vaccinated, they're standing 10 feet away from me, I'm masked. En este minuto tenemos suficientes casos de COVID en este condado para estar en la situación de usar la máscara en todas las situaciones cuando estamos adentro de un edificio. No importa si estés vacunada o no, porque aunque las personas con la vacuna se pueden enfermar, aunque es más leve, y se pueden transmitir el virus. Okay. So, let's see. So moving right along. If you could go to the third slide now. There was one slide that I didn't include, which is the question of where are we? What is the strain? Basically, there was a pie chart at the meeting that was almost all Delta. There was like a little sliver of everything else. So this is definitely a Delta virus surge, the Delta variant. Ahorita la gran mayoría de los tipos de virus que está ocurriendo en esta comunidad es el tipo Delta. And that's actually not good because, as I'm sure you've heard by now, the Delta strain is more contagious and it's more aggressive. Even vaccinated people can get it. The good news is that if you're vaccinated, it'll be a much milder case, much milder. So there is a point to being vaccinated. El tipo de Delta, como yo creo que hasta ahorita todos lo hemos oído varias veces, es más recio, es más fuerte, más probable, más contagioso, y si se enferma se pone más enfermo. Aunque las personas con la vacuna se pueden enfermar, pero gracias a Dios que en esta situación la enfermedad es más leve. Let's see. And the final slide that I'd like to touch on is the one that says Kane County vaccination rates. I think we're actually doing pretty good. In particular, I'm very encouraged that the older population, which is more vulnerable, has 93% in our county have at least had one dose. And actually the total percent of population vaccinated is with at least one dose is 67%. Como se pueden ver en este condado, las personas avanzadas de edad que han tenido a lo menos una vacuna son 93%, que es en mi opinión bien bueno, y el porcentaje de personas, de todas las personas que tienen la vacuna es 67%. Okay, so that's the overview from our meeting today, and Martha has arrived.
Yes,
and
I'm going to blame it on the Kimball Street Bridge.
Oh God, yes.
Closure, even though there's no traffic now.
It's construction season is ending, but it's not over yet.
That's exactly right. Well, welcome back, Dr. Poulos. Thank you for being here tonight, and thank you for the updates from the meeting earlier today. We have some questions lined up for you.
Mm-hmm.
And there's a lot of confusion right now in the terminology that's used about what is a third shot and what is a booster.
Mm-hmm.
And are they one and the same? Are they physically identical, the same shot? This is a question that I think is puzzling many people.
Okay. They are, in terms of physically what's in the syringe, it's the same thing. Mm-hmm. The difference is how it's used and who is the person that gets it. Mm-hmm. The third shot is for a very limited group of people that we feel have low immunity, not a good immune system, and will need a third dose to get that initial immunity. And it's fairly narrowly defined. People that are actually getting cancer treatment, not someone who had cancer maybe years ago. People that have had organ transplants and are on medication all the time to suppress their own immune system. People that are on very high doses of steroid drugs. Those people, it's an actual third shot to get the initial immunity. The booster is different. The booster is a much broader population, both older people and also younger than 65 who are in certain professions that are at higher risk. For example, I would fit into that because I'm a physician. I think teachers would also, in my opinion, because of their contact with children that are unvaccinated by definition. So those people, it's the same vaccine, but it's given at least 6 months after the last dose. And that takes your already good immune system, which may be starting to drop off, and gives it a little push. Okay. So, en español, la confusión, yo entiendo que hay confusión entre esas dos cosas, la refuerza y el tercer dosis. La medicina es la misma, la vacuna es la misma, pero el tercer dosis es para personas en situaciones muy limitadas que están recibiendo tratamiento para cáncer o que tienen trasplante de riñón, pulmón, algo así, y hay que tomar medicina para bajar su sistema de anticuerpos. Esas personas no pueden formar suficientes anticuerpos con las dos dosis y necesitan un tercer dosis. Al revés, la refuerza es por un grupo de personas muy más grande. Primero, las personas que tienen más que 65 años de edad, y segundo, las personas más jóvenes que están en algunas situaciones o enfermedades o ocupaciones, como en la medicina, en la educación, que tienen más contacto con el virus.
Muy bien, gracias, doctora. Parece haber mucha confusión y contradicción entre la Casa Blanca y la CDC y la FDA acerca de la booster, de la vacuna de la refuerza, y de que si se pone a los 8 meses, a los 6 meses.
Sí.
Quizás pudiera aclararnos eso.
Sí, pues no es que tanta que hay confusión o que no están de acuerdo. El problema es que esta ciencia está desarrollando tan rápido que a veces se pone así muy confundida de quién están decidiendo. Hay que tomar como unos o 2 días a veces para esperar que todos se junten en una decisión. También algunas de esas decisiones son varían de país a país. Hay países en Europa, por ejemplo, que tienen otras vacunas o que tienen otro régimen. No es que ellos están equivocados o nosotros estamos equivocados, es una ciencia que es muy complicada, que está en desarrollo. Y, por ejemplo, yo creo que fue lo que para mí me ayudó bastante por clarificación fue apenas el viernes en que por fin decidieron cuáles son las personas por la refuerza, y también hace unos días antes de eso, permítame, como más o menos una semana antes de eso, cuáles fueron las personas para la tercera dosis. Es decir, que para mí como médica en este minuto yo no estoy confundida. El problema es que tratar de explicarlo a otros.
Okay.
So the question was, there's a sense of confusion. Is there a disagreement between the FDA, the CDC, and the White House? And the answer is no. I really feel as if they are all on the same page. The problem is the speed at which things are developing and decisions are being made and the research is coming out is so fast that unless you're right in the middle of it, and most people have lives where they're doing something else, you can get confused. I think that what was very helpful Friday is that they finally came out with a firm recommendation on the Pfizer booster. Also, that actually several weeks ago, they came out with who are the patients that need the third dose. What is the definition of altered immunity? Because at first they said just, oh, decreased immunity, and people are like, well, what does that mean? You know, I take a puffer for my asthma. Does that mean I have decreased immunity? No, it doesn't. Yeah. Let's see, was there, the other question that is a follow-up question that I think you should ask is, we keep talking about the Pfizer vaccine. What about the other ones? Well, in this country, we also had Moderna and the Johnson & Johnson, and I just heard Dr. Fauci today in an interview say that he expects that data and those decisions to be coming very soon. So it's not like those patients have been forgotten about. Otra cosa que es muy importante es que hay un gran número de pacientes que han tenido otra clase de vacuna, no solamente de la compañía Pfizer, pero de la compañía Moderna o Johnson & Johnson. Y apenas oí de Dr. Fauci en la televisión hoy que están muy cerca, tal vez unas semanas, para tener una recomendación sobre refuerzas o terceras dosis de esta vacuna, de estas vacunas.
Okay. Another question that's been asked a lot around the third shot and the booster is whether people need to present documentation to qualify for the third shot. Do you know if that's being required?
That I have, what I understand is no. And for example, that when people present to a lot of the pharmacies have these, of course, and the pharmacies are not asking for a letter from your doctor or anything. They're just, that would make it too unwieldy, in my opinion. What to me makes a lot of sense, though, is before a patient decides that they should be having a third dose or having a booster, certainly for that third dose, to talk to their physician.
Okay.
Yeah? But no, there's my understanding, there's no requirement for any piece of paper that says I am immunosuppressed.
Muy bien.
Del tercer dosis, de lo que yo sepa y de lo que yo he oído, no requieren un comprobante que dice que necesitas el tercer dosis, pero por supuesto la cosa lógica es de discutir o consultar con su médico para ver si él o ella se recomiende.
Okay, another question that people have asked is whether you can receive the third dose or booster along with a flu shot.
Yes, definitely.
Okay.
Eso es cierto. Antes, como hace un año o hace como unos 6 meses, era una recomendación de no recibir las vacunas demasiado juntas, como de esperar 2 semanas. Ya no. Ya dicen que se puede recibir el mismo día. The most recent recommendation is that you can get the flu shot and the COVID shot the same day. My preference would be for it to be in opposite arms, just so that one arm doesn't hurt too much. But the older recommendation to wait at least 2 weeks in between is no longer recommended.
Okay. And are the side effects for the booster or third shot the same as they were for the first and second dose?
Just about, everything that I've been hearing is a sore arm, perhaps a low-grade temperature like 99, a headache perhaps, and lasting about 24 to 36 hours at the most. So, los efectos secundarios del tercer dosis son más o menos iguales con las primeras, una leve temperatura, dolencia del brazo o tal vez un dolor de cabeza.
Okay. Muy bien. The holidays are coming up, and so what would be your advice relative to family gatherings?
Well, my advice would be certainly if for a small or cozy family gathering where you feel that you know people well enough and feel comfortable enough to know their vaccine status, if everyone in that household or at that party is vaccinated, I don't think it's necessary to mask. There are a lot of things in life are a matter of how much uncertainty. You know, as I was just saying, vaccinated people could still have the Delta virus.
Mm-hmm.
I know some people that choose, when they're going to a family gathering, they choose to go and get a test. If it's, but I wouldn't say that you must do that, but I think if you wanted more security, more caution, yes. It's a different story if you're going to a gathering where you don't know everyone, or it's awkward to ask if they're unvaccinated, or you know there's unvaccinated people. At that kind of gathering, my personal recommendation would be to try to minimize, to wear a mask and to only remove it for like the time that you're at the dinner table. Like I went to a wedding where there's no way I could figure out who's vaccinated, who's not. It's not even honestly polite to run around asking people. So I pretty much kept my mask on the whole time, dancing and everything, except for while having a meal, and it just happened that the people at our table were all vaccinated.
Okay.
So it's a matter of, it's a tough call. La pregunta fue ¿qué vamos a hacer con las fiestas que vienen? En mi opinión, si estás en una fiesta en que usted conoce a las personas que son vacunados, que personalmente lo que yo haría es de no usar mi máscara en esa situación. Si quieren, especialmente si una de las personas en esta fiesta es una persona muy delicada, muy vieja, tal vez de sufrir de un test, que los tests son gratis, right? Los tests son gratis, sí. Entonces, ¿por qué no hacer un test antes de irse para visitar a su abuela en Texas? ¿Cómo no? Si es una fiesta o una reunión en que no conoce toda la gente, mi opinión es mejor usar la máscara, porque viene el invierno, vamos a estar adentro de una casa, y de quitárselo lo más mínimo solamente para tomar una bebida o para comer. Pero esa es mi recomendación.
Okay. Y la doctora habla de que fue a una boda y como no sabía el estatus de las personas que estaban asistiendo, ¿verdad? Pues claro, entonces
pues no se puede, no es
no se
cortés
puede-
preguntar de cualquier persona.
sí, no es práctico tampoco, porque son muchas personas las que asisten, entonces ella mantuvo su mascarilla puesta durante la fiesta, bailando, y solo se la quitó para comer. Entonces pues ya según también las personas, ¿verdad? Si tienen el conocimiento de las personas que están allí,
Yeah.
que mismamente usted acaba de viajar.
No me acuerdo, ¿lo dije en inglés o no?
Sí.
Okay.
Ujú. Mismamente, usted acaba de viajar, y qué recomendaciones también para las personas que van a viajar.
Pues para los viajes, aunque no está, yo creo que va a ser obligada todavía de ley federal de usar la mascarilla en tren, en el avión y todo. Y de eso estoy completamente de acuerdo. Y la misma cosa como él estaba discutiendo sobre las fiestas. Si está viajando en el invierno en este país, probablemente vas a asistir a cosas que están adentro de edificios, de usar la máscara. Okay? So for trips, for traveling, and in fact I'm pretty sure it's still the law for any kind of interstate travel to use a mask on public transportation and on kind of mass transit, airplanes, trains, buses. That would make sense. Does it have to be a double mask? I know some people feel more comfortable putting a double mask on. It's extra protection. I think for like a 12-hour bus ride or something, it might be awfully uncomfortable to try to maintain that, but at least the one mask. And because the winter activities are usually indoor, the common sense thing to me is that if you're going to a concert, to keep your mask on. And I think most of them are going to require it. I got an email from the Elgin Symphony saying, welcome to the concert I'm going to go to on Sunday, and they would like to see a proof of COVID and a mask. I'm fine with that. The mask does not cover my ears.
And you may have covered this earlier in your update from Kane County, but are they planning to reopen the vaccination
Yes,
centers?
I'm glad you asked.
Okay.
Kane County Health Department is opening up the Vax Hub in the Sam's Club in Batavia. So far, I haven't heard about the East Side one, and it's going to be open on Wednesdays and Saturdays, either walk-in or appointments. And it's the website is Kanevax, KANEVAX.org.
Okay.
So el condado de Kane va a ofrecer las refuerzos y el tercer dosis, y en su lugar en Batavia, en Randall Road, 501 Randall Road, y la página del web es kanevax.org.
Okay. What can you tell us about the vaccines for the children younger than 12? I mean, when do you think we can expect them?
Well, just today there was an interview with the president of Pfizer, who, by the way, is Greek, and he said that they're going to be presenting their data to the FDA for the younger children soon, that the dose is probably going to be about a third of the adult dose.
Okay.
So, de las vacunas para los niños, probablemente en unas o 2 semanas, la compañía Pfizer va a ofrecer su data por el FDA por los niños que son más jóvenes, con un dosis más pequeño, por supuesto.
Okay, very good. One of the questions here was that if one of your patients was hesitant about taking the vaccine, about receiving it, how would you encourage them to take it?
Well, I think the most important step is to ask them first, because what is the hesitation? Because it could vary, So I really base it on what their concern is, and I try to answer that specific concern. I also point out that, well, not only have I had the vaccine, with no ill consequences, but that millions of people around the world have had this vaccine. We've had the vaccine since really for 9 months now, and there's that's plenty of data. If people are waiting for more data, we have enough data. Now would be the time, because the more the virus replicates and makes these mutants in mostly in unvaccinated people. And Delta is only the 4th letter of the Greek alphabet, and we don't want to go through all the letters and be in this pandemic forever. So
Yes.
that would be the time. So, la pregunta fue cómo de responder a la gente que tiene miedo sobre las vacunas. Y mi opinión es, primeramente, de entender qué es la preocupación del paciente y después de tratar de contestar a exactamente a la duda que tiene.
Okay. I also wanted to take some time to let our viewers know that we will be hosting a clinic here at the library on Friday, October 1st, from 9 a.m. to 2 p.m. The Pfizer vaccine will be available in first, second dose, and in booster. And we will also have the flu shot. So if any of you are interested, you're welcome to visit our website at elgincovidhelp.com. And you can self-register. Of course, you can register at our table. We're here from Monday through Friday, 1 through 5 p.m. And you're also welcome to walk in if you'd like to. But probably getting an appointment is not a bad idea, so you're not waiting long. So we encourage that. Les queremos saber a nuestra audiencia que este viernes, 1 de octubre, vamos a tener una clínica aquí en la biblioteca de 9 de la mañana a 2 de la tarde. Vamos a tener disponible la vacuna de Pfizer, ya sea para primera dosis, segunda dosis o para la vacuna del refuerzo. Y inclusive vamos a tener la vacuna para el flu, que como dijo la doctora es aconsejable también tomarlo y se puede tomar en conjunto con las otras vacunas. Si gustan pasar, pueden venir, pueden hacer cita, pueden encontrar información en nuestra página web, que es elgincovidhelp.com. Y o pueden venir o pueden hacer cita. Aquí estamos de lunes a viernes de 1 a 5 de la tarde. Bueno, para cerrar, doctora, deje ver aquí. Entonces, le quería preguntar me pasaba a preguntarle de los mandatos para trabajo. ¿Qué impacto están teniendo? Usted está viendo que
pues yo creo que van a tener buen impacto, porque primero que las personas que estaban un poco dudosas los está puchando un poquito a decidir usualmente a tomar la vacuna. Y segundo es que los mandatos están más importantes por situaciones en que la gente en este trabajo es muy delicado. Por ejemplo, yo estoy 100% de acuerdo con los mandatos para hospitales y para casas de ancianos y para las escuelas. Esa es mi opinión. Yo estoy de acuerdo con el gobernador. So the question is, what is the impact of the mandates? It seems to me that the mandate overall, in the long run, the impact will be good. First of all, in that there are some people that have still been on the fence or hesitant that may be pushed or inspired by the work mandate to finally get the vaccine. And secondly, it is to make the workplace a healthier workplace. The mandates specifically are applying to places where people are very vulnerable. I personally am very much in support of the mandates in the healthcare setting, in nursing homes and in schools. And I agree with the governor's position on this. I think those patients are very vulnerable, those people are very vulnerable, and those of us that work in that setting should be doing our best to protect them.
Okay. With that, we'd like to wrap up the session today. And again, we encourage you to come stop by on Friday if you're not already vaccinated, or if you're eligible for the booster shot, or if you need the flu shot. Con esto le vamos a dar fin a nuestra sesión esta tarde y de nuevo los invitamos a que pasen el viernes de 9 a 2 de la tarde para que les den su vacuna Pfizer, primera, segunda o booster, la del refuerzo, e inclusive también la del flu. So, aquí los esperamos para los que gusten pasar. Muchas gracias, doctora, por haber participado. Sé que está recién desempacada de su viaje, pero aún así estaba muy preparada para ayudarnos. Thank you, Dr. Poulos, for joining us today. We know you have just traveled back home and had to do a lot to prepare for this, and we really appreciate the time you've taken us to bring us up to date on what's happening here in our county.
Well, thanks very much.
Okay, you're welcome.
Thank you.
Adios.
Bye-bye.